afternoon, all. We're going to let some people continue to filter in. Welcome to those of you in person and also those of you who are joining us online. My name is Jillian Arias. I'm an associate professor here at the School of Public Health in the Health Policy and Behavioral Sciences Department. And I also serve as the chair for our Grand Rounds Committee. And it's my pleasure to join you to our final Grand Rounds session for this academic year. And I want to take just a second before I introduce the speaker to acknowledge those who've contributed to the planning of this year's Grand Round series. So that includes our Grand Rounds Committee, April Ballard, Kevin Maloney, Christine Stauber, Anne-Marie Shapani, Lucy Pavova, Harry Hyman, and Dan Whitaker. I also want to thank Rodney Dean Lynn, for continuing to support this adventure. It has been a joy of the last 3 years for me to get to continue to chair this and to host this and to bring in wonderful speakers. We would not be here today but for Sam and Jordan, making sure that everybody knew that there was a session happening. And so thank you to you both for doing such a fantastic job and making our lives truly easier. Mary Manchester has been serving as the point person for our student breakfasts and other organizing events during the series. So thank you so much, Mary, for stepping into that role. And then finally, well, let's also thank Tech for supporting us. But without Marcus Cooper, literally nothing would happen. He makes my job so much easier. I get to see the credit while he makes it just run so smoothly. And every single one of our speakers consistently comment on how great their visit is. And that's because of Marcus. So thank you. So it is my joy and honor to not get emotional when I do this introduction, and I'm going to do my best, but there are a few times in your career where you get to reach back to earlier times in your life and acknowledge and recognize somebody who's built your career literally alongside you from the ground up, and that is, for me, Professor James Hodge of Arizona State University. James Hodge is the Peter Kiewit Foundation Professor of Law. I could go over his achievements, but they would be too many to cover, and I think you will see the strength of his scholarship and the work that he presents today. On a personal note, it was James who first introduced me to public health, so Rodney, but for him, I would not be standing here today. It was because of James that I made my first visit to CDC, which was one of the very first visits that I came to Atlanta, and he introduced me to a broader community of health law scholars who've helped me shape and mold my career. As he probably knows, there's many jokes I could stand up here about the things that he's taught me in the lessons that I've had, but I think I'll keep that for our lunch today and just say thank you so much, James, for everything you've provided in my career and for visiting us here today. Thank you. In mentor fashion, he reminded me I didn't turn the mic off.
Let me do a quick sound check. Are you all hearing me well? Fantastic. You know, it's a pleasure to be able to join you all here today, back in Atlanta, back at Georgia State. Dean Lynn, thank you so much for the opportunity to be here, to Jelaine for the fantastic work. She credits me with anything in relation to her career. I just give opportunity. You got to be a superstar like Jelaine to actually make it, and she's doing that on a very high level and so nationally well recognized for everything she's accomplished. Pretty heady topic here today. Let me give you all a sense of what I hope we can accomplish in the time that we've got, with opportunities for questions and comments after I finish giving you a little sense of the portfolio of what's before you now, emerging from the U.S. Supreme Court in this current term. We're not going to talk as much about what this court's done to us over the last 5 years since COVID or otherwise. We're talking about what's happening right now. Some lessons, however, from court's previous jurisprudence will come to the surface, and some of you all may have questions about, like, how does this particular forthcoming opinion affect us as contrasted with other decisions you've seen as well. And I'm also conscientious that against the backdrop of what we're seeing currently from the existing presidential administration in the first 40 days of President Trump retaking office is changing this game literally before our eyes. So I'm fully aware of that. Highly conscientious of it. You may ask any questions you like when we get to that portion of the program. My focus today is on the U.S. Supreme Court, and here's our game plan for what we hope to accomplish. You know, we're here again. I've been doing these particular types of assessments of the U.S. Supreme Court and impacts in public health for several years. And each year I kind of think, all right, that was the most impactful year. I can't imagine them doing more than bowling over Roe versus Wade. I can't imagine them doing more than stripping affirmative action away from universities and other settings. I can't possibly imagine more than them completely derailing administrative deference in regards to the agencies as they did last summer with Loper. But here we are again in what I predict will be the most impactful and dynamic term before this U.S. Supreme Court in public health and healthcare law and policy, yet again, for the third straight year in a row. So what I'm going to try to do is just give you a little sense of what we're eyeing up through my colleagues at the Center for Public Health Law and Policy at Arizona State. My colleagues and I are constantly watching what this court's up to, and while we won't go into great depth about everything the court's not doing, like all the cases they didn't accept review of, or all the cases that they're passing on and other reasons, I'm going to hone you in on cases that we're watching closely, but then take you right into what I call my top 10. These are the top 10 cases currently before the U.S. Supreme Court that absolutely will result in a decision, at least from what we can expect, that will have impacts. Those cases may change because of what else this court is looking at, including current things before President Trump's administration. But for the moment, we're going to talk about those brief facts and issues of those 10 cases, hone you in on what's actually at stake from a public health or healthcare perspective. Then I'm going to give you my forecast. Like, what do I think is going to happen in relation to this specific decision? Now, I may prove to be wrong about that forecast, but we've generally gotten it right many years in a row, so I'll show you a little bit of what we've got in mind. Questions, comments for sure at the end. In fact, an illustration of cases you'll see here in a second I'll put up at the very end again so you have that to think through. When I talk about keeping a watchful eye on the U.S. Supreme Court, I'm talking about dozens of cases that have some repercussions in the public health arena that we're looking at carefully. We're really closely assessing what the court may do in these. These are kind of our honorable mentions, if I may, to our top 10 list otherwise. And so these cases include things that really could impact public health and healthcare, like a case, Cunningham versus Cornell University specifically, involving ERISA-related terms. If you don't know what ERISA is, if you have any health plan through your employer whatsoever, ERISA governs that. And anytime the U.S. Supreme Court even remotely moves into this arena of interpreting ERISA, which is a complicated federal scheme, it can change the dynamics for healthcare benefits in the United States. It's got a case to do exactly that in a different setting. We'll see what happens there. There's a medical marijuana versus Horn, a case involving personal injury issues, and whether there's a sort of racketeering theme at work here. Probably not going to actually rise to the level of that top 10, but we're watching it closely. A case, Smith & Wesson brands versus Estados Unidos Mexicanos, being argued right now for the U.S. Supreme Court today. The Mexican government has sued multiple gun manufacturers on whether or not their policies for marketing their specific weapons have resulted in obvious deaths and morbidity in Mexico, and whether there's a legitimate claim they can bring seeking damages for that. We'll see what the court thinks on that. If you're wondering, how can that not be in my top 10? You'll see why. There's another gun case that's out there. Mohammed versus Taylor, a free exercise case looking at public school education and just how far we can go under First Amendment principles to restrict education in public settings against the backdrop of gender-affirming care and other specific themes. Profound. The court will hear this case soon. And then finally, McLaughlin Chiropractic Associates versus McKesson Corporation. If you don't know McKesson, it's one of the big drug manufacturers, one of the big distributors, that is. You may be wondering, why is this case not front and center? Because it's actually not about what McKesson or even this Chiropractic Association's done. It's about an interpretation pursuant to the Federal Communications Commission, or the FCC. Why is it even on here then? This Supreme Court may use this in another case in this specific term to actually change the game administratively on what and how far we actually delegate authority to federal administrative agencies by revising or at least reinterpreting what we've previously seen as an antiquated doctrine known as the non-delegation doctrine. Stated simply, if this court adopts what they're being asked to look at carefully in these specific decisions, what you saw as far as the rescission of agency authority and ability to interpret federal statutory law will be a blip on the screen compared to what Congress would have to do to actually authorize agencies to act at all. The non-delegation doctrine is there as a separation of powers principle, basically to say, Congress, you either spell it out to agencies as to what their authorities is, or they don't have them. Just imagine what that might do in upending the cart about what CDC, FDA, HHS, and others are actually authorized to do. We shall see. That case is before us, and we'll be watching it carefully. Here are, however, my top 10. So these cases are going to dominate our discussion. We'll be brief on each one of them. If you want to know anything more factually or from a legal theory in relation to what you're going to see me walk through here, do ask away when we get to the Q&A portion. I look forward to that opportunity. In fact, the very screen you're seeing right now with these 10 cases will be back up front when we get to Q&A, so to help you remind you what we're going to explore. We're going to crisscross the country, but do you know what you're seeing on screen that's kind of interesting? Look at all the stars. Where are they? Why do you think that's true? Is it perhaps because plaintiffs are jurisdiction shopping in the United States for the most favorable decisions out of the Fifth Circuit or Fourth Circuit or other circuits of which southern federal district courts and appellate courts have been more favorable to their causes? Quite possibly. But the Supreme Court's taken them up on this specific bait, and as a result, we're going to be able to discuss cases looking at gender-affirming care in U.S. versus Scrimeti, Ames versus Ohio Department of Youth Services, just argued this past week before SCOTUS. This is going to be profound. We're talking about discrimination, plausible discrimination against majority whites under Title VII. It's going to be interesting to see what comes out of that because the court looks like they're unified. Advocate Christ Medical Associates versus Kennedy, that is Secretary Kennedy, a Medicare-related case you'll see momentarily. Medina versus Planned Parenthood, right out of South Carolina, focused on whether or not that state can actually limit access to abortion clinics through Medicaid-related benefits. You'll see that momentarily. Stanley versus City of Sanford, Sanford, Florida, an ADA, Americans with Disabilities Act case with repercussions for all of us in regards to who's qualified to make a disability claim. Williams v. Reed, the only case for which I'll present to you today that actually has a decision from the U.S. Supreme Court. That'll be our first up. Later we'll go and look at Kennedy versus Braidwood. This case, what it could do in relation to actual agency authorities, specifically related to one of the most pivotal federal agencies interpreting what and how far Affordable Care Act guidance and coverage goes in the United States. It's front and center before this court. We'll see that in just a moment. Free Speech Coalition versus Paxton out of Texas. Wait for it. It's one slide you'll see where I do not have an image for you. You'll know why. And finally, Bondi, as in Attorney General Bondi versus Vanderstock. That's our ghost guns case. That's the predominant case I'm looking at from the Second Amendment specific perspective, but it actually has other administrative regulatory issues at work as well. So let's take these cases on together. Let's explore them along the following lines. I'll give you a little bit of facts, a little bit of what we've seen. I'll give you a little prediction of what the Supreme Court may do in relation to it. Most importantly, try to set the context for you well so you can get a full sense what might this Supreme Court do this term that could impact how we actually protect the public's health. Let's start with the one case that I've got for you with a rescission. By the way, at the bottom of every screen, you're going to see a little time bar down there, and that will give you a sense whether or not or where we are with the specific Supreme Court jurisprudence, including petition file date, date they granted cert, which is a nice way of saying the date they agreed to review the case, oral arguments, when were those scheduled, and when the decision was rendered, as in this case, just about 10 days ago. Williams v. Reed is an interesting case because it does extend back from COVID-19. And what you saw in Alabama was during COVID-19, the Department of Labor absorbed, as most every state did here in Georgia and my state in Arizona, absorbed thousands of claims for unemployment. And at times, what you saw in relation to the administration of those claims was just poor administration across the board. Failure to respond, failure to give a decision, failure to provide unemployment benefits. About 20 Alabamians actually sued over this ground, basically saying years removed now from COVID, they still never got an affirmative decision from the Department of Labor. And they sued under what's known as Section 1983 under federal law. Stated succinctly, that section under federal law lets you sue state agents for violating your federal constitutional rights under the color of state law. It's a nice way to force a particular state agency to do their job if there is a constitutional violation. And in this case, about 20 Alabamians said, yeah, our due process interests were violated. We never got a decision. The Alabama Supreme Court said, and you're never going to get a decision because you haven't exhausted all administrative remedies that we require in the state of Alabama for the purposes of getting a decision on something of that nature. In other words, have you done everything through the Department of Labor you could have done to get a decision? Because if you haven't, your claim is not ripe for us to review. Sounds a little technical. It's a nice way of the Alabama Supreme Court doing what Justice Kavanaugh identified as a catch-22. You can't bring a claim because you haven't exhausted your remedies to the very agency that's denying you those remedies. And what you see in regards to this opinion is Justice Kavanaugh, with a fairly good majority of the court, making clear that does not qualify in regards to limiting a Section 1983 claim. Nicely stated, as succinctly as I can, those Alabama residents who were denied those basic privileges of getting access to unemployment commission, they do have a Section 1983 due process claim. That's a good outcome because what you're seeing across the board in regards to millions of Americans that consistently fall for unemployment or health benefits experience these types of delays all the time. Cutting that red tape underlying some access to federal or state courts through Section 1983 is a pretty darn good outcome. As a result, you can imagine what my forecast is. This is going to be the most favorable screen you're seeing in this entire program. Hey, we're all clear. This is what you would want to have seen from the U.S. Supreme Court. They're allowing access to courts for this type of regulatory denial of programs and initiatives, and this could really help a lot of Americans seeking that type of liability against the backdrop of health benefits, public health, or otherwise. Good, clear forecast. Going to be the best one we see. The next case, Medina versus Planned Parenthood. This is our South Carolina case. Here's the state of South Carolina attempted to actually terminate Medicaid enrollment agreements among providers to whatever extent they provided abortion services. If you're providing them, you can't provide Medicaid services in our state. This is profoundly against, during the Biden administration, existing federal law. And Planned Parenthood, along with some patients, actually argued that that specific intervention violated directly the Medicaid Act. How did they make that argument? Again, Section 1983. And what's neat about it is they're raising the same basic type of constitutional argument that the Medicaid Act actually provided them some federally assured guarantee of getting to access any willing provider pursuant to the Medicaid programs there. Problem is the lower courts have a debate over what type of standard to use to assess whether that Section 1983 claim can go forward or not. There's still debate within that. The district court at the lower level, the Fourth Circuit Court of Appeals in Richmond all found that there's just no dependent or no definitive way to assess what the Supreme Court jurisprudence should be on this particular interpretation. The court did find favorable that there is a private right of action that would sustain the Section 1983 claim, but that's what the Supreme Court's here to determine. And their oral arguments haven't even been had yet until April 2nd. We'll learn more then. Why does this matter? You know, these denial of challenges to state law or policy-based decisions that restrict specific providers, despite federal Medicaid requirements that at least for the moment are still in place. These definitively limit access on key services in key jurisdictions if these things continue to be put into place. Spending provisions that allow for this type of recognition of a constitutional claim under Section 1983 is a sort of bulwark or a sort of a buttress against this type of denials by states. This is a good development, but we don't know yet what the Supreme Court will do, and thus, as a result, my forecast on Medina, without more information from the U.S. Supreme Court during oral arguments, it's smoky. I don't know how to call it yet. Their favorable decision in the prior case in Williams suggests their Section 1983 jurisprudence may allow for a more interpretive guidance here to let this claim go through, but we've got to learn more about exact disposition of the court on this particular front. Wait and watch to see what this court does here. But if it decides in favor of the state of South Carolina, we're talking about a lot of states given a gold card to start implementing specific provider restrictions over what they politically want to accomplish in their jurisdiction or not. U.S. versus Scrimeti. Now we're going to get to some even more controversial provisions. Tennessee, like multiple other states, Arizona included, bans puberty-delaying medications and hormone blockers used to treat minors who do not conform to their sex assigned at birth. Now, if you need those same treatments for another purpose, it's okay. That's fine. Tennessee will let you have access to that, but not for that specific purpose to actually change sex other than what is assigned at birth. Tennessee Senate Bill 1 was put on federal trial in a district court back about a year and a half ago, so this thing's weaved its way to the Supreme Court over multiple months. And basically, they made clear, the federal district court in Tennessee said, this is clearly violative of equal protection. You can't set a standard for that type of minor's patient and then allow the same drugs for other patients under similar circumstances. You can't do it. Violates federal law under the Constitution. Sixth Circuit stayed that specific provision, but they did so evaluating this equal protection claim raised by multiple minors and their parents in Tennessee under what we call rational basis review. Basically saying, hey, if Tennessee had some basis for actually implementing these specific measures, then let it go. We're going to allow this specific bill to go through, not an equal protection violation. That's what got before the U.S. Supreme Court as to what actual standards should be used for the purposes of assessing these particular issues. During oral arguments, we did see multiple justices, probably, in my view, enough, 5 out of the 9, ready to uphold what you're seeing in Senate Bill 1. And just to be clear, again, the backdrop here against the federal administration, you know completely what President Trump's position is on this. His executive orders make extremely clear no access of any minor to these specific drugs or treatments for the purposes of gender-affirming care. Tennessee and so many other states look like they might win on this specific front. Now, what are the public health repercussions? They're bigger than what we know. First of all, these bans have led to a greater of 50% of transgender youth potentially losing access to these specific services. Loss of those protections go much further. We're talking about potential constitutional allowance for assigned gender versus gender identity restrictions, gender-neutral bathrooms we've been through already in North Carolina and fronts. Those could be outlawed in that regard. Sports and extracurricular participation. You're well aware of President Trump's executive orders on those specific fronts. NAACP falling in line with that. Even anti-transgender litigation already in Eastern Kentucky at District Court there, basically rejecting Department of Education transgender protections that President Biden attempted to put into place. Do you really see what's going on? This is state legislatures telling doctors and parents and patients what the standard of care will be. Legislators dictating to medical professionals what the standard of care is. This is always dangerous ground, because how far they may go in regards to setting standards of care for so many other conditions is directly front and center in regards to this specific measure. My forecast here, you can imagine, this is foreboding. A decision in favor of this specific Senate bill is a decision also in favor of all those executive order treatments you're seeing in this specific arena. And no matter how the evidence comes down, as we're seeing competing evidence over gender-affirming care, the simple reality is many doctors do not agree with these types of restrictions. Legislating dictating to them what those restrictions are, that's going to be interesting. Kennedy, as in Secretary Kennedy versus Braidwood, at least for the moment. And by that I mean we'll see whether Secretary Kennedy just drops this case entirely. What you've got at work here is one of the most profound series of circumstances administratively under legal regulatory provisions that you could imagine before this court. It wove its way to the court out of Texas, in which a federal judge at one point in time literally tried to take down completely the U.S. Preventative Task Force. Not on grounds that their job has been done incorrectly or such, on the grounds that the people that are on that task force should have been appointed by the president under the Appointments Clause in the U.S. Constitution. And thus, if they weren't appointed by the president, believe me, they weren't, not by President Biden, not by the prior presidents since the Affordable Care Act came into play, if they're not appointed by the president, everything they're doing, said that federal district court judge, unconstitutional. You know what this Preventive Task Force does? They tell the nation under authority from Congress exactly what specific measures should be covered under the Affordable Care Act. And just to make sure we're all clear of just how big those determinations are, it's not just those persons that get those ACA plans that we're listening to for this. Virtually every health plan, including all those ERISA plans, look to the guidance of this task force for the purposes of saying, what do we have to cover, what should we be covering, what measures are in place, and how much guidance should we be using for that purpose. The Fifth Circuit affirmed the lower court's judgment, the Fifth Circuit based out of New Orleans, that the task force did violate the Appointments Clause. They rejected the reasoning for it at the district court level, but they kept in place that specific question. Does the President of the United States have the authority, and only the President, to appoint the members of this specific task force? What's at stake? Total legitimacy of the task force and its role in approving dozens of healthcare services. The sorts of things when they get on the task force list are the types of things Americans with ACA plans don't have to spend out of pocket for. They get guaranteed coverage for it. Things like mammograms, contraceptives, cancer screenings, vision and hearing screening, all covered under the ACA. If what this task force does is abandoned via guidance from the U.S. Supreme Court because the President of the United States has to appoint those members, do you shudder for just a second thinking about who President Trump might appoint? And furthermore, if you're like, I'm not sure I'm up for that, the backdrop's not, because guess who actually makes the appointments? Secretary of HHS. So we're not in a good situation here no matter what the outcomes of this case, but I'm telling you straight up, that forecast is not good. We're talking thunderstorm material here for sure. This is very controversial. And again, it's not solely because of what this task force does. Every other federal agency, just like it with that sort of administrative authority, could be challenged under similar measures like CDC's Advisory Committee on Immunization Practices, currently under the crosshairs of this administration. ACIP could be similarly viewed. Oh, it will get interesting fast. Thunderstorm material here, we'll see exactly what decision we get out of that Supreme Court soon enough. Oops, I apologize. It's kind of going crazy on me. Let me go back to this just to make sure I can get to the right case for us. Sorry, clicker's just messing me up a little bit. Here's our case, FDA versus wages and white line investments. Let's be brief in regards to what we're seeing here because this is a challenge to FDA authority. Yet again, agency, regulatory authority being challenged consistently post-Loper. And this particular challenge comes forward as to whether or not the FDA had the ability to actually restrict a particular e-cigarette liquid from being distributed to minors or anybody else. FDA said, you can't prove the marketing of this won't actually affect minors and won't impact or injure minors, so as a result, we're not going to allow you to market it and put it out there. That got the objection from the industry, and the industry in and of itself raised a series of additional challenges. Making those challenges consistent with sort of due process-related violations that FDA did. You did not properly apply the review procedures to our specific product, and for that reason, what you determine must be unconstitutional, or at least against the Administrative Procedures Act. Again, because of arbitrary, capricious determinations. Now, during oral arguments, we did see some justice intimating that FDA review actually wouldn't change no matter what standard of review that the FDA applied to it, because the federal law was in place under the Federal Smoking Prevention and Tobacco Control Act. But we don't yet have a determination of what that court's going to do after its oral arguments this past December. And most importantly, we have a new administration. And as per the footnote to some of these cases, they could drop this challenge any moment. The FDA could be told by the Trump administration, drop it. We're not challenging it. As a result, push your product forward in regards to the nicotine and e-cigarette markets. That's projected, potential, and to be sure, the impacts are profound. If the Supreme Court gives us a decision on this without the case being dropped, we may have the potential for a declination of FDA's regulatory authority over tobacco products. We could see post-Loper implications, which is a nice way of saying just how far this court will go to impose those sort of restrictions on who's in charge of making determinations of what federal statutory law says. Federal agencies like FDA or the Supreme Court. Talk about loss of control over the regulatory ability we have that's been so hard-earned over tobacco and nicotine products in the United States that Congress has even, over multiple Congresses, approved. This court can undo it. I don't like what I see, but I don't have any more arguments to propose in regards to what the Supreme Court may do. I'm calling this one hazy at this moment. It's hazy. It's going to be tough to know exactly how the court will come down on this, but it may be consistent with some of that anti-regulatory authority theme that this court's taking on systematically. Here's the case Paxton, that you're not going to get an image on screen for good reason. Texas, like so many other states, wants to heavily restrict minors' access to porn-related websites and other specific sites that are offensive. U.S. Supreme Court has recognized in its First Amendment jurisprudence there is some type of language and or imagery that can be cut off to minors especially. And to be sure, that's all Texas is saying they're out to do. We're actually just out to make sure that if you're going to see this type of imagery on the internet or web, you're going to have to demonstrate where a particular site has a third of its content that could be potentially harmful to minors. That's the language in this Texas bill. We're going to require you to affirm you're over the age of 18, you lawfully see this particular information. That's what Attorney General Paxton in Texas has promoted. That's what the state legislature passed, and that's what the governor signed. But it got challenged as a First Amendment violation by the industry. Their argument's pretty simple. Hey, it's lawful material. We're putting it out on the web, and that's lawful as well. And you're restricting access not just to minors, who we don't contest whether they should have access, but to adults as well, because you're requiring them to meet some litmus test for the purposes of accessing our otherwise legitimate First Amendment protected information. Now, as you saw this one weave through the lower courts, getting before the Supreme Court in oral arguments in January, you're seeing the court discuss what and how far you can go in regards to actually protecting minors under the First Amendment. What do we start to see related to it? Justices like what they see in this Texas bill. They seem to favor the nature of what Texas was after. Protecting minors is never a bad outcome. First Amendment doesn't allow them to see this, and if you go a little bit overbroad in relation to the protections you put into place, this could be fun. Do you see the repercussions? Because I do. Access to potentially harmful online materials via minors, nobody wants to allow that for sure. But where do you stop in that line? How far can Texas go? Or other states just like it? How far could they go in regards to impacts on other forms of publicly available media? Advertisements, books, movies, podcasts, music. Remember that whole thing from 30, 40 years ago in regulating the music industry? This case is about that. It's the newest iteration of that. How far can government go in the interest of protecting minors to stop the flow of otherwise legitimate information to them and, frankly, a lot of others? And just so you know, what about that website that tells you where you can go to get an abortion legally in the United States? What about that website that tells you, here's where you can get gender-affirming care? We're going to put restrictions on that, Texas? That's what's at stake. You know, literally putting that stamp of First Amendment approval on that level of implementation. It's about restricting access to what could be otherwise viewed as very legitimate and potentially public health-oriented and healthcare assuring information. I don't like my forecast on this case at all. I'm calling it frigid, as in freezing up First Amendment protected speech in the interest of protecting minors, with no litmus test or barometer for how far the Supreme Court will go on that specific front. Let's wait and see just exactly how far the court may go, but I will guarantee, at least from the moment, I think they're favorable to what they're seeing in Texas. Ames versus the Ohio Department of Services. If you're tracking the Supreme Court the way we are, you know the Supreme Court just issued oral arguments in this case last week, and what they showed us during oral arguments was pretty darn surprising because of what's actually at stake here. Ames is a woman, she's straight, and she's white. And she's been working at the Ohio Department of Health Services or Youth Services for 15 years. Things are going pretty well for her in her career. And then one day, her boss switches gears. She's LGBTQ. And her boss actually demotes her. And then later, there's an opportunity for her to actually get a promotion, and she's denied it. And she claims, I'm a white, straight woman who just got discriminated against because this LGBTQ boss of mine just promoted another LGBTQ woman over me, and I've been consistently demoted in my position. I've got a specific Title VII claim here I can raise for discrimination. You see, if you're raising this claim of the member of a majority group, you generally have to impose, as the Sixth Circuit noted in Cincinnati, You got to impose something beyond just saying, I was discriminated against. You got to show us background circumstances. You got to do something more than just that, because otherwise you have the potential for these claims to come forward with white majority persons arguing for discrimination in the backdrop of where we tend to not see discrimination. Ames says, that can't be. I'm no different than anyone else. Under Title VII purposes, I could be discriminated against. And you know what? I think the Supreme Court agrees with her because of what they showed us during the oral arguments. Setting two different standards for why one person of one racial class should be able to pursue one of these claims versus another person in a different ethnicity or other protected group like LGBTQ persons or otherwise, that's patently offensive, patently unlawful. I think the court's giving us a clue to. The repercussions here, if this court carries forward on what could be actually one of its more unanimous decisions, oh, you're seeing it, right? Everything that President Trump and his administration are doing to essentially outlaw DEI initiatives, and everything we've worked hard for the purposes of eliminating discrimination, providing fair and equal opportunity for all Americans, oh, it's on trial in this case. Because if white majority persons can actually sue on the grounds of discrimination under these circumstances, under the very same tests that persons who have traditionally, historically been discriminated against, is there no end to what types of claims may arise? The potential chilling effect on DEI is already palpable, but if the Supreme Court endorses this level of just any discrimination of any type, no matter what class of person you're coming from, it will all but annihilate DEI initiatives constitutionally, in my view. You can look at this screen and you can ask yourself, what are we looking at here in my forecast? Sunrise? I don't think so. This opinion, if it comes down the way I think the Supreme Court forecast, we are sunsetting specific anti-discrimination claims or discrimination claims that might have been brought under differing, more favorable standards by so many Americans, because white majority Americans will be able to bring the very same claims. It shall be interesting to see. Stanley versus City of Sanford. We're not talking about discrimination on just ethnicity or majority class or otherwise, disability discrimination. And what Stanley sort of experienced here is what a lot of firefighters in the United States and others that are in those very risky jobs, emergency workers and otherwise, often experience, which is disability in their positions. And they have claims under the Americans with Disabilities Act. Stanley had those claims, but in the middle of retiring from her position after acquiring Parkinson's condition, relying on the City of Sanford to actually provide disability protections and certain measures in place, she has to retire. In the middle of that retirement, they changed their policy. They withdrew continued health benefits and pension benefits. And she says, I can't believe this happened. I have to retire via disability. Certainly I have a ADA claim. But you see, under the Americans with Disabilities Act, you have to be a qualified individual. A qualified individual is employed by the entity discriminating against you via disability. And so the case here is whether or not, as SCOTUS had their oral arguments on January 13th, whether or not she has a continued claim at all under the Americans with Disabilities Act for what is very much viewed as egregious discrimination against her on disability-related grounds. There was quite a bit of debate during that. It's going to be tough to call this specific one. Justice Kagan and Jackson actually explored whether discrimination actually did occur while she was employed there, based on some of what drove her to retire. But we're not real sure how this one's coming down. I'll tell you what's at stake, though. What's at stake is the 25% of persons right now in the United States, aged 20 years old or more, that probably will be entitled to some disability-related benefits during their working career before age 67. So a quarter of those persons are going to have some disability claim, but when will they get to raise it, under what circumstances? And just to be sure, firefighters especially, laudable as their job is and as essential as they are to our health and safety, 60% of them more actually report some degree of physical demands lending to disability at some point in their specific career. Avoidance of disability-related discrimination is really key for this specific population. I don't particularly know or like what we're seeing, but I'll at least call this forecast cloudy. Don't know if the Supreme Court will attempt to bootstrap this specific individual to claim for discrimination based on her lack of employment. We shall see, but right now I'm calling it cloudy. A couple more cases, and then let's look forward to your questions and comments. Advocate Christ Medicine, or Medical Association versus Kennedy. Got a lot of hospitals out there in the United States, in rural settings, treating patients and needing CMS, Center for Medicare and Medicaid Services, to reimburse for those specific treatments based on a lot of different principles, one of which is their sort of applicability or their opportunity to be disabled or viewed as such under SSI. The whole debate behind this specific case is CMS has previously paid these rural hospitals for patients that are eligible for Medicare-related purposes. Maybe they haven't secured it yet, but they're eligible. That's a non-controversial point. And all that's being asked here by these rural hospitals at this point is, pay us for the patients that are also eligible for SSI disability through Medicare, but haven't sought it yet. If they're eligible, pay us like you would if they were eligible for Medicare for other purposes. It's not clear whether or not that's required. And CMS, because there's a pretty big bill at the end of this specific statement, has resisted doing it even during the Biden administration in which this case came about. We're seeing oral arguments reveal whether or not the justices will agree as to applying a particular standard that would allow for the payment to these rural hospitals based on those SSI patients that haven't yet gotten their disability determinations. We're not yet seeing sufficient guidance as to whether the court will go that particular route, but it has an opportunity to. What's at stake? We're talking about access. We're talking about hospitals on the margin in the United States, closing definitively across the U.S. over the last decade, needing every federal dollar possible to actually pull off what they're trying to accomplish and create an opportunity for access to healthcare services among our rural populations. Here in Georgia or in Arizona or any other state, you cut off this specific opportunity, you're cutting off tens of millions of dollars to these specific hospitals, already of which we're seeing 75% of rural counties in the United States literally in medical deserts. We know about food deserts, these are medical deserts, and thus leads to my forecast here. I don't like what I see here either. I don't like it because this court is highly aware of what the Trump administration policy is in regards to Medicare and Medicaid at this point, restricting payments, restricting coverage. Let's call these programs back. And if this court is politically minded, as I think it could be, I've got a very arid forecast ahead on this. Don't expect Supreme Court endorsement of these specific Medicaid benefits for the benefit of these rural hospitals. We shall see, but I'm hopeful, just not planning on it, working towards that end. And our final case, Bondi versus Vanderstock. It was the Biden administration that recognized the problem we have in the United States with ghost guns. Guns for which the parts can be assembled easily and quickly and produce a lethal weapon, but yet completely evade prior regulatory rules that existed under federal, congressional, or statutory authorization. So ATF, the Bureau of Alcohol and Tobacco and Firearms, created new regulations to govern ghost guns. Those regulations were challenged. They were challenged a little bit on Second Amendment grounds, but honestly based on regulatory authority of ATF. And again, implicating that significant regulatory theme that we consistently see showing up and cropping up in this U.S. Supreme Court. Does ATF's authority go sufficiently far to actually allow for these ghost guns to literally be regulated as if they were any other firearm in the United States? We have a new Attorney General. And believe me, those federal positions previously argued by Attorney General Garland are changing. They're shifting. Luckily, the court's already rendered its oral arguments. What's at stake here? Tens of thousands of guns, potentially unregulated in the United States if the Supreme Court determines that that bureau, ATF, lacked regulatory authority to govern them, despite what I think looks like pretty clear congressional authority to do it. But again, back to that theme we just discussed. Non-delegation doctrine. How far will this court go? Could they actually eliminate the federal government's ability to actually regulate these ghost guns? They've already resulted in deaths across the United States, as we've seen. problematic, but we don't have enough guidance from the Supreme Court for me to call anything other than foggy on this specific forecast, because I don't know if this court will go that far. Chief Justice Roberts, along with Justice Barrett, did seem to intimate they could favorably see ATF regulating in this arena, because Congress was quite clear in spelling out what a firearm constitutes. But it's foggy until we know more about how far this court goes on non-delegation fronts. Now, with all that said, special thanks to you all for your attention to these matters. My great student at ASU, always working consistent with me on these specific interests. I'm looking forward to opening the floor to questions, comments, and thoughts you all have about it. Jolene will keep us track on time. Without further ado, I'd love to take any questions or comments you have. Jolene, are there microphones people should use?
Yes, there are 2 microphones right here, so just raise your hand and
I will.
team members.
Yeah, and thank you so much. And to our virtual audience as well, we hope the microphones will help you hearing the question. I'll maybe try to repeat it a little bit in case we run into issues. So go ahead.
I don't know what something's happening.
Thank you. Thank you. Yeah, if the microphone presents problems for us, just hold off and I'll repeat the question for our virtual audience. Go ahead.
Could you talk a little bit about jurisdiction shopping and how that influences these cases?
Yeah,
so
it's on display.
Going forward with some of the things that are happening, does it tend to be where federal appointees may be appointed by a certain, like, Democrat or Republican? Okay, so maybe I just don't know about it. Thanks.
Yeah, you're asking the right question, because that's exactly what's being manipulated in the United States. And this is no new game. It's not like, I've never seen this before. Of course we've seen it. If you were pursuing pro-democratic principles on some of these particular fronts, you're not shopping in these states in the Southeast and Texas. You're shopping elsewhere. You're going to be coming out of California or Illinois or Massachusetts or what have you. But the reality is you're seeing the Supreme Court in the health arena really take on these specific tough cases coming out of these jurisdiction shop type cases. Now, some like Stanley you're seeing down in Florida, this happened in Florida and she has to go through that specific federal district court there. But other fronts, like you're seeing out of Texas in regards to the Bondi case, the free speech case, that was absolutely shopped to the exact same Fort Worth district court that produced Braidwood initially. And so as a result of that, you're seeing direct intervention designed by plaintiffs to find courts favorable to their particular outcome, often which are egregiously entering these very broad national injunctions against the backdrop of specific decisions of which federal courts of appeal can correct for briefly, and the Supreme Court can issue emergency sort of declinations on. But the sheer reality is, there's no doubt in my mind as to why I'm highlighting these cases. These are dominant health law, public health law cases, and they're being shopped in states that are permissive or at least interested, federal district court-wise, in hearing those arguments. That's happening across the United States, and these cases are chosen out of there because they're impactful. There's no mystery to me or surprise that they're showing up in these jurisdictions. Great question, and yes, it is purposeful and intentional. So additional question down the road there, go ahead.
Maybe you can just repeat.
I can hear you well. I think everybody else can too. Great.
Now, I don't want to like jump outside of your prepared remarks, but something happened this morning that kind of went viral in the environmental health community, and I'm not a lawyer or a court follower, so I wanted a little bit, maybe if you had some insight on the San Francisco versus EPA case where the court ruled in favor of the local jurisdiction and their wastewater discharges regulation authority by the EPA was reduced.
One of the things I always try to do is not opine on a case that I've not closely followed in that respect. And with apologies, even in the environmental front, although it does get our attention, particularly on climate change and other fronts, I try not to follow the environmental side of it. So I don't have any opinion for you at this point in time on what we may have seen out of that federal district court in San Fran. Be happy to look into it, but I just don't have any intel on it directly at this point.
Okay, I was just curious if that was like far-reaching or very, very local.
I don't know. I'd have to see exactly what that was. A federal district court, I presume?
No, it's the Supreme Court.
The U.S. Supreme Court issued an opinion on that today. Yeah, we have not. I've not been tracking it for sure.
Okay.
Thank you. I apologize. I'll take a look to it later. Additional questions?
Is it on? Oh.
Yeah, we're
Okay.
here.
Well, to begin, thank you so much for this talk. I think it was
pleasure.
very informative considering everything that's going on. I had a question kind of regarding Ames versus Ohio's Department of youth services.
Right.
For one, do you believe that the ruling made last year regarding affirmative action being overturned will have influence on how the court decides to rule in this case? And with that, do you believe that if the court decides to rule to believe this Title VII violation was actually valid, how would this affect public health initiatives, particularly pertaining to marginalized groups such as women and people of color?
You bet it will. Already what you saw in that affirmative action case in which the court basically rendered and told all of us in the public and private higher education arena can no longer use race as a factor at all for the purposes of making student-based decisions. So that's had repercussions into the public health arena, but this case in Ames I think could have even more. Because what the court will be affirming in relation to that, if it issues the opinion that I think it will, is that you're not going to use race or ethnicity or any of those factors for making any of these government-related decisions, like on what programs you fund CDC, on what initiatives you normally would set aside some vaccines for kids of a certain ethnicity or minority or what have you, to make sure that they get vaccines, for how you allocate federal dollars, if you're going to devote it just to these specific causes that generally impact specific groups, all of it subject to challenge. That's what this Supreme Court, I think, is actually highlighting, is its capacity to clarify to federal agencies and to the executive branch overall, Congress as well, don't make race-based, ethnicity-based, religious-based, or any other basis for how you actually do public health in the United States. Now, get smart fast about what factors you can use, and believe me, we are getting smart fast about what those factors can be. Social determinants, income-related levels, specific proximity in particular locations. But if you remember during COVID-19, you all recall this out of Texas? When we were specifically running up against the allocation of vaccines early on in the pandemic and them not reaching sufficient number of Black Americans, and counties like in Oregon and in Texas, like Dallas County, literally saying, all right, we recognize the problem. We've got a significant health disparity here, and we're going to set aside these doses of vaccines just for Black Americans. That got challenged successfully in Texas. Can't do it, said a court there, on equal protection violation. This U.S. Supreme Court seems interested in bestowing, or sort of using that same theme here to equalize these distributions, even though, obviously, as we can clearly understand from the public health perspective, we're not co-equally situated in regards to the threats to the health of American populations. The Supreme Court seems quite intent on making sure, but you got to allocate your resources that way, or make your decisions based on that. Constitutional repercussions aside, that's exactly what I think we may be seeing. So we'll have to get very smart very fast about the formulas we're going to use for the purposes of accomplishing public health objectives without saying it's about this race or this sex or this particular population, or else we may trip those wires that land us all in federal district court or state court for that matter too. Great question, and I see those repercussions happening if this court continues on this same line of thinking as it's shown repeatedly in prior cases and also the one in Ames. Additional questions, comments, or thoughts? Dean, go ahead, please.
Thank you so much for your presentation. Curious about the concept of strict scrutiny and how does the court determine a compelling interest? If groups are going to be treated differently, what's to say when there's a sufficient interest in treating groups differently, whether we're talking about access to jobs or access to I think you have a discrimination case there about ADA.
Yep.
Can you just talk a little bit about that principle of sort of compelling interest or governmental interest in treating people differently?
You bet, Dean. I mean, it's a great question because it does garner a lot of attention before the U.S. Supreme Court. And several of the cases that you saw me illustrate here was really about what standard do we use? Do we have to use strict scrutiny? If you do, as Professor Kirshner and I have worked through public health law for so many years on this specific front, If a court imposes strict scrutiny on a public health measure, here's the general outcome. Public health, you lose. Because you can't demonstrate there's a compelling state interest in that the intervention you've chosen to use is the least restrictive intervention possible for the purposes of infringing on individual rights. So under equal protection or due process or other fronts, when government is required by the Supreme Court to adhere to a strict scrutiny standard, generally government loses. Like, find some other intervention, local health department or state health department, because you can't justify this. The infringement on individual rights is too profound. As contrasted with rational basis, all you got to prove there is government had some rational basis for doing what it's doing, and if it uses that standard, here's the deal. Public health wins. Dean, what's going on here now is whether and how far this Supreme Court would impose that strict scrutiny standard on what it would otherwise have previously viewed under rational or what we sometimes called heightened scrutiny. The concern we've got is that this Supreme Court uses race and other factors against that backdrop, even though it sounds right at times when Chief Justice Roberts says, there's no basis for using race for the purposes of making these critical decisions. Let's equalize this across all populations. Well, that's not what people experience in the United States, obviously, and we're trying to equalize against that backdrop. If strict scrutiny is imposed, government loses, generally. And in public health, when we have to make tough choices about who gets access to what services, be it on sexual grounds, male-female, transsexual grounds, whether it's on race, ethnicity, national origin, or other fronts, it's getting the Supreme Court's ire. They're looking at that as an actual guise for discrimination, whereas before, the Supreme Court saw it for what it actually was, correcting for discrimination that was occurring. That's the big concern we've got. That's, I think, the trend you're seeing before this year's Supreme Court. And if it carries it through, we all are going to have to get savvy and crafty fast about how you get those resources to persons most in need without tripping those wires. Does that help a little bit think that through? It's not always the government would lose, and just to maybe try to punctuate that question, government can win when it can demonstrate we really do have a compelling interest here in making sure that this population gets access to that COVID vaccine because they're dying from it at a rate far excess of what we're seeing, and we have some justification. I love it. But it didn't play out in Dallas County. They didn't win on that grounds. It's just going to be, for all of us, a real tripping point should this court continue to manifest that line of thinking. And I think it will. I really do. I think it has the votes to pull it off. It could be 5-4 decisions or 6-3, but I think we are expecting to see more of that ahead. So, just to give you all a little bit before we get too depressed about that message, hey, we're smart enough and capable enough as public health officials, and lawyers working with all of the colleagues that you may see here at Georgia State and other places, get smart fast about how you defeat that so that the public's health is maintained against the backdrop of those new legal standards. We will find a way to do it, but it's going to have to get improved in regards to what might have been simpler measures for making those critical determinations. Good stuff. Any further questions? Jillian, we doing okay on time? All right, I'll take one more if there is another. I do see a person in the back there, I think. Yes, please.
So in Williams, it seems like the decision that plaintiffs didn't have to exhaust turned on the delays in the administrative process.
Yes.
Do you think the court would have come out the same way if there were no infirmities with the administrative process?
Nope, not for a second. Yeah, if the Department of Labor in Alabama had simply said, you know what, you don't get unemployment compensation at this point in time, Alabamians. Sorry, I know it's been 3 years or what have you, but we did make a final determination and you just don't get it. The Supreme Court will let that decision ride right on through. Justice Kavanaugh correctly identified as a catch-22. And he was basically saying in regards to that decision from the court just this past week, if you're gonna as a state agency, be it public health, labor, or any other agency, if you're gonna create this sort of catch provision that people can't actually get out of it a decision necessary to actually raise in court, what would be the administrative opportunity for you to do so, to challenge that specific measure, that's the problem. It's not the decision. If the State Department of Labor had just said, you don't get these unemployment benefits for whatever reason we decide, the U.S. Supreme Court would have walked away from that particular controversy and moved on. It was they created that catch-22, and thus the limited nature of the Reed decision, just to be clear, is it was really quite defined around the fact that Alabama, as for a statutory requirement, would not let you pursue a Section 1983 federal claim unless you exhausted all of those administrative remedies. All this the U.S. Supreme Court said in Reed is, yeah, that's unconstitutional. You can't do it. Section 1983 preempts that type of determination. Don't read it for anything else, but the hopeful prospective value for what we see in the other Section 1983 case out of South Carolina. So I'm kind of hopeful on that front. Fair interpretation there. I think we'll see plenty more on that decision as far as how it plays out in the next several months ahead. If there's anything I want you to take away from this particular session, we're not dead in the water here. We're not up against the wall with no legal or policy objective we can accomplish against the backdrop of what this U.S. Supreme Court, or frankly, this president, is doing. But it is time to get innovative and ingenious in public health, figure out in real time as we go forward, what or how do we accomplish those specific objectives against this backdrop. That's what we're doing and working towards as a legal community, and all the public health legal scholars, Professor Kirshner and Professor Arias, we all are working towards that specific objective, but we definitively need to hear from public health officials and leaders as to what we're trying to accomplish and strategize how to get it done. That message is the one we're continuously profound in regards to. As I was telling an audience of some of your great students earlier, public health will prevail out of this. But we're going to have to get ingenious and crafty, fast. And we are. So without further ado, thank you all for having me. It's been a delight to be able to join you, and keep the questions coming anytime. Thank you.